The first thing they noticed about her was that she was quiet. Not shy quiet, not nervous quiet. The kind of quiet that doesn't explain itself, doesn't fill silence with apologies, doesn't smile when it doesn't mean it. Nurse Linden walked into Mercy Coast Regional Medical Center on a Tuesday morning in October, carrying a single canvas bag and a coffee she'd made herself. And when the charge nurse at the front desk looked up and asked, not unkindly, but not warmly either, "You the new float they sent us?" Linden said yes, signed the paperwork, clipped her badge to her scrubs, and went to find her assigned bay without waiting to be shown. That was the first mark against her, as far as some of the staff were concerned. The ER at Mercy Coast ran hot. It was a level 2 trauma center on the Florida Gulf Coast, pulling patients from 3 counties, 2 highways, and a stretch of coastline that turned deadly every summer when tourists forgot that the ocean had no interest in their vacation plans. The staff had built something over years of shared exhaustion, a particular rhythm, a particular shorthand, a way of moving through chaos together that felt, to the people inside it, like family, and, like most families, they didn't always welcome strangers easily. Dr. Hensley was the attending on that first morning. He was good at his job, and he knew it. The kind of doctor who announced his own arrival with the sound of his shoes on the tile, who spoke in sentences that expected no interruption. When he came into Bay 4 and found Linden already mid-assessment on a chest pain patient, he stopped in the doorway. "Who authorized you to start without a physician present?" Linden didn't look up from the EKG she was reading. Patient presented with diaphoresis, jaw pain, and pressure radiating to the left arm. I started the 12 lead. It's showing ST elevation in leads 2, 3, and AVF. There was a pause. "I can see what it's showing," Hensley said. "Then we agree we're looking at an inferior STEMI." She stepped back from the bed. "I've already called cardiology," they said. 8 minutes. He stared at her for a moment longer than necessary. "Next time, you wait for me." "Yes, sir." She said it with no edge in her voice, no resentment, no sarcasm, no visible frustration. She just said it. And then she went to prepare the IV line because the patient needed it and there was no one else standing there to do it. That was the second mark against her. In a place like the Mercy Coast ER, competence without performance was a confusing thing. The people who got along best were the ones who translated their skill into a kind of social currency, who made their knowledge visible, who built alliances over shared eye rolls, who participated in the ecosystem of complaint and mutual suffering that made 12-hour shifts bearable. Linden didn't do any of that. She did her work. She said what needed to be said. When she wasn't needed, she stood at the edge of things and watched, and the watching itself made people uncomfortable, as if she were cataloging something. Nurse D'Ambrosio, who had been at Mercy Coast for 11 years and had strong opinions about almost everything, decided within the first week that Linden was arrogant. "She thinks she's better than us," she told the others at the nurses' station during a lull. "You can tell. She's always watching like she's running some kind of evaluation." Nobody said anything to the contrary. It was easier not to. Dr. Hensley, for his part, begangs the float pool supervisor on minor charting corrections he attributed to Linden. Small things, the kind of things that happened in every ER every day, but things he didn't bother tracking for anyone else. He mentioned, casually, in a department meeting, that some of the newer staff could benefit from reviewing protocol for patient handoffs. He didn't look at Linden when he said it, but everyone else did. What none of them knew was where Linden had learned to read silence. She'd grown up in Pensacola, the daughter of a Coast Guard mechanic, and a woman who dispatched 911 calls for a living, which meant she'd understood emergencies as a language before she understood them as events. She'd enlisted at 19, gone through basic at Great Lakes, and from there her file described a path that didn't quite fit the standard shape. Corpsman school at Camp Lejeune, a rotation with a Marine recon unit in Helmand Province, a second deployment to a forward operating base in eastern Afghanistan, where the nearest surgical facility was 40 minutes by helicopter on a good day, and where good days were not the majority. She did not talk about any of this, not because she was ashamed of it, not because it was classified. Most of it wasn't, or at least not the parts that mattered. She didn't talk about it because she'd learned, slowly and at some cost, that the people who talked about it most were the ones who'd been there least, and she had no interest in sounding like that. Her experience lived in her hands and in the particular stillness of her face when things went wrong, and that, she had come to believe, was enough. She spent 6 years in uniform. She came home at 25 with a DD-214, a set of skills that no classroom had given her, and a very specific kind of patience that people sometimes mistook for coldness. She'd gone back to school, done the RN program, then the BSN, worked a year at a VA hospital in Tampa, where she was, for the first time in years, among people who didn't need her to explain herself. Then the float pool, which she'd chosen deliberately. She wasn't sure yet which version of nursing felt right in civilian clothes, and the float pool let her learn without committing. Mercy Coast was her 4th assignment in 8 months. The incident that changed things happened on a Thursday 31 days into her rotation. It started the way the worst days usually do, not with a single catastrophe, but with a slow accumulation of pressure, one thing stacking onto another until the structure beneath them gave way. By noon, the ER was running at 140% capacity. There was a 4-car accident on Route 98, a suspected meningitis case in Bay 7 that required isolation protocols and kept 2 nurses out of rotation, and a generator maintenance window that had bumped 3 elective procedure patients into the ER for overnight observation. Hensley had gone to lunch. Dr. Nakamura, the second attending, was in with the meningitis patient and couldn't be reached without breaking protocol. The charge nurse, a steady woman named Rutledge, who Lyndon had come to respect quietly, was managing the waiting room overflow. Lyndon was restocking Bay 3 when the ambulance bay doors opened. She heard them before she saw anything. The particular sound of a gurney moving fast, which is different from a gurney moving routinely. She came out of the bay and stopped. There were 4 of them, men, late 20s to mid-30s, in civilian clothes that were torn and darkened with something that was already oxidizing to brown at the edges. One was walking under his own power but holding his left arm at an angle that indicated structural damage. One was on the gurney, unconscious, with a field dressing around his upper thigh that was soaked through. One was crouched over the gurney speaking in low, rapid sentences to the paramedic beside him. And the 4th was standing apart from the others near the wall, breathing in the deliberate way that means pain management by will. The paramedic reading from the transfer sheet was saying something about a training exercise, a water rescue simulation, a winch failure. Lyndon was already moving. She got to the gurney and pulled back the edge of the field dressing and looked and made 3 decisions in approximately 4 seconds. "What's his pressure?" she asked the paramedic. 82 over 50 on scene were still. "How long since this was applied?" The man crouching over the gurney, the one who'd been talking, looked up at her. He had the kind of face that had been outdoors for a long time. 22 minutes, he said. Precise. No approximation. She looked at him. He looked at her. Something passed between them that had no name in this environment, but would have had one in a different context. Get him into trauma 1, she said, and I need someone to call Rutledge back here right now. D'Ambrosio appeared at the edge of her vision. You can't take him to trauma 1 without an attending. Nakamura's in isolation and Hensley's at lunch. This man has a femoral bleed that's been tamponated for 22 minutes, and his pressure is in the floor. Linden didn't raise her voice. We're taking him to trauma 1. I'm going to have to report this. Please do. She was already pushing the gurney. Can you help me or not? D'Ambrosio, to her credit, helped. In trauma 1, Linden did what the situation required. She did it methodically and without wasted motion. The way she'd learned to do things in places where waste had consequences that couldn't be undone. She talked the patient through it, even though he was unconscious. Because her first supervisor in country had told her once that unconscious didn't mean unhearing, and she'd never been able to fully unlearn that. She called out what she needed in clear terms, and the tech who'd come in behind her. A young man named Foss, who'd been intimidated by her for a month, moved without hesitation because her certainty was more compelling than his uncertainty. By the time Hensley walked back in at 14 minutes past 1, the patient was stabilized, typed on, with a surgical consult on the way up from the 3rd floor. Hensley stood in the doorway of trauma 1 and looked at what had been done without him. Who authorized? I did, Linden said. She was stripping off her gloves. I'll document everything. His pressure was incompatible with a wait, and both attending physicians were unavailable. I made the call. The silence in trauma 1 was the kind that accumulates weight. This isn't a forward operating base, Hensley said. This is a hospital. We have protocols for a reason. The patient is alive, Linden said. The protocol didn't account for this specific situation. You operate outside your scope again, and I will personally see to it that your float assignment ends today. She looked at him steadily. Yes, sir. He left. D'Ambrosio was standing near the supply cart. She didn't meet Linden's eyes. The man who'd been crouching over the gurney found her at the end of the hallway 20 minutes later. He was wearing a borrowed scrub top over his tactical pants because someone had cut the other shirt off during triage. He moved the way people moved when they were used to moving quietly. Not sneaking, just economical. He stopped a few feet away from her. He's going to make it, Linden said. She wasn't looking at him. She was writing in the chart. I know, the man said. Surgical team told us. He paused. I'm Warrant Officer Dex. I'm sorry. Old habit. He stopped himself. You can call me Kellum? She looked up then. Kellum, she said. He had very steady eyes. Where'd you train? It wasn't a casual question. She recognized it as what it was. The kind of question that is a door, and the asking of it is a way of knocking, and the answer determines whether the door opens. Lejeune first, she said. Then Helmand. Then Phobe Sharana. Something in Kellum's posture changed, not much but perceptibly, a degree of ease that hadn't been there before. Sharana, he said. That was a bad year, most of them were. He nodded. Not sympathetically. She didn't need sympathy, and he seemed to know that. Just acknowledging. You were a corpsman? 8404, she said, which was the Navy enlisted classification code for an independent duty corpsman. The ones who deployed with units that didn't have a medical officer attached, which meant the ones who learned to do everything. Kellum looked at her for a moment. Then he said, Simply, thank you. Not for saving the patient's life, exactly. Or not only for that. She understood the more specific thing he meant. Go check on your guys, she said. He went. She was at the nurse's station an hour later when they came back. She heard it before she processed it. A shift in the ambient noise of the ER. A low collective sound that meant people were stopping what they were doing and looking at the same thing. She turned around. There were 6 of them walking through the ambulance bay doors. They were in working uniforms, not dress, not ceremonial. Just the utility uniforms they'd apparently been wearing when the training accident happened. Dried now and put back in order where they could be. They moved through the ER with the particular unhurried certainty of people who are used to entering difficult spaces. Kellum was with them. He stopped in front of the nurse's station. Lyndon was standing behind it. Around her, the ER had gone very quiet. He didn't say anything long. He didn't make a speech. He looked at her and came to attention. A sharp, precise, full military brace, and held it. Behind him, the other 5 did the same. The ER was absolutely silent. Hensley was standing near the trauma hallway. He had walked out to see what the commotion was, and now he was standing very still, watching. D'Ambrosio was near the medication cart. She had stopped moving entirely. Foss, the tech who'd helped Lyndon in Trauma 1, was watching from the doorway of Bay 2 with something complicated on his face. The salute lasted maybe 4 seconds. Then Kellum relaxed and said, in a voice that carried without effort, "We owe her." He didn't explain further. He didn't elaborate on what Lyndon had done or who she was or what her background included. He didn't need to. There are things that are communicated without words in situations like this, and everyone in that ER who'd spent their career reading rooms understood exactly what was being communicated. Lyndon held herself very still behind the nurse's station. She nodded once, the way you acknowledge a thing without making it bigger than it needs to be, and said, "Glad he's stable." Kellum nodded back. The group moved toward the elevator bank to go up and see their man in pre-op, and the normal sound of the ear slowly reconstituted itself around the space they left behind. Hensley didn't say anything to her that afternoon. He didn't say anything to her the next morning either. But the CC'd emails to the float pool supervisor stopped, and when a code was called in Bay 6 at 7:30 on Friday, and Lyndon was the first one in, he didn't say anything about scope of practice. He just came in behind her and worked. D'Ambrosio started leaving her coffee on the break room counter. She didn't say anything about it. Lyndon didn't say anything about it either. The coffee was there in the morning, and it was good coffee, and that was enough. Foss stopped being intimidated by her and started paying attention to her instead, which was different and better. He started asking questions. Careful, specific questions about assessment and prioritization, and she answered them directly, without softening them into teachable moments, which was exactly how he needed them answered. The other thing that changed, the quiet thing, the thing that isn't really a thing you can point to, was the way the room oriented to her. People stopped looking past her and started looking at her. Not because she'd asked for it, not because she'd said a single word about where she'd been, or what she'd done, or why she knew what she knew, but because the room had seen something, and rooms don't forget what they see. She'd learned a long time ago that credibility built this way was the only kind worth having, the kind you carried in your hands, in your decisions, in the particular quality of your stillness, when everything around you was falling apart. You couldn't give someone that kind of trust. They had to arrive at it themselves, on their own terms, in their own time. It usually took a crisis to get them there. She'd stopped resenting that a long time ago, too. The patient's name was Brennan. She found out later through Rutledge, who'd heard it from Foss, who'd heard it from the surgical floor. Staff Sergeant Brennan, 29 years old, from Biloxi originally, married with one daughter who was 3. The winch failure on the water rescue simulation had sent him into the hull of a training vessel at speed, and the resulting laceration had nicked the femoral artery in a way that the field dressing had slowed but not stopped. He spent 3 days in the hospital. He walked out under his own power. She wasn't there when he left. She was in the middle of a 12-hour shift on a different floor. But Rutledge told her about it that evening with a particular look on her face, the kind of look that means something that happened has stayed with her. He asked who the nurse was, Rutledge said. In Trauma 1. Lyndon filed the last chart she was working on. What did you tell him? I told him her name was Lyndon and she was on a float assignment and she'd been in the Navy. Rutledge paused. He said, and I'm quoting, he said, "That tracks." Lyndon smiled. It was a small smile, the kind that didn't need an audience. Get some sleep, Rutledge said. You too, Lyndon said. She gathered her things and walked out through the ambulance bay the way she'd walked in 31 days ago. Canvas bag, coffee she'd made herself, no particular explanation owed to anyone. The difference was that now, when the doors closed behind her, she didn't feel like a stranger. She'd been in enough places to know that feeling didn't usually come from being welcomed. It came from being necessary, at exactly the right moment, in exactly the right way. That was the only homecoming she'd ever known how to make.